All right, so if you get a certain kind of tattoo, you could get a certain kind of eye disease. This is like really serious stuff. I never heard of this before. So we have with us today Dr. Ashleigh Levison, and she's a vitreoretinal surgeon with the Retinal Consultants of Arizona. Nice to have you on the show, Dr. Levison.
Thank you so much for having me.
So I have never ever heard of this. This disease is uveitis.
Yeah, so uveitis, it's a group of inflammatory disorders of the eye, and it can affect part of the eye, it can affect the entire eye. And while most patients, it's isolated to the eye only, up to 40% of patients can actually have an associated systemic disease.
Wow, from getting a tattoo, like a certain kind of tattoo?
So there has been some described cases in which patients who have black ink tattoos can develop uveitis approximately 6 months to 1 year after their tattoo. And in addition to having inflammation in their eye, they tend to get inflammation of the tattoo itself. So they can have part of the tattoo that becomes inflamed, or actually the entire tattoo can become inflamed.
Wow, this is sort of an allergic reaction to the ink, do you think?
So the truth is, it's so rare that the actual underlying cause is not really fully understood. There's some patients who, upon workup for this condition, are found to have a systemic disease called sarcoidosis. And that's a disease that causes inflammation in their lungs, but also in their eye. And then they tend to get skin rashes, and so their site of their tattoos become inflamed. But there's also been cases in which patients without sarcoidosis develop this inflammation in their eye and in their tattoo. And it's thought, maybe it's just something about the ink, because again, no ink for tattoos is FDA approved, so there's different components. So there might be something in that ink that the body recognizes and becomes inflamed against, and then that inflammation is found in the eye as well.
Well, it is so interesting, because I guess this is a tattoo no matter where you have it on the body, but here it is affecting your eyes, which is strange. Now,
exactly.
I happen to be allergic to fingernail polish, but my hands don't itch if I use it. I get an itch, on my face. So it's kind of a strange thing how the body reacts. Now, let's say that I had the unfortunate, thing of uveitis. Would it be visible externally, Dr. Levison?
So uveitis can affect different parts of the eye, especially when it affects the front part of the eye. The eye can become very red. Some patients can even develop something called a hypopyon, which is you see a white layering in the front part of the eye. But other than that, patients have a lot of symptoms. So they can have pain, they can have sensitivity to light, they can have blurred vision, they notice a lot of floaters. So there's a lot of symptoms associated with it in addition to the external signs.
Wow, I tell you, that is really scary looking. Is it itchy or sore, Dr. Levison?
It can definitely be associated with pain.
Oh, okay.
It tends not to be itchy. That's usually more of an allergy.
I see. What about the inside of the eye? What's happening on the inside of the eye with uveitis?
So patients actually get inflammatory cells that are floating around the front part of the eye. They can get it in the back part of the eye. They can actually get these inflammatory lesions that actually grow in the back of the eye and can create blurred vision as well.
Wow. Does it cause blindness eventually? Anything like that?
Yeah, so in the acute setting, when somebody first gets an episode, they have decreased vision due to the floaters themselves, due to swelling in the back of the eye. But unfortunately, chronically, uveitis can lead to a lot of structural damage to the eye. So patients can get cataracts, they can get something called glaucoma, or unfortunately, they can get scarring in the back of their eye. So it's always very important that uveitis is treated to prevent the long-term consequences of the disease.
I've just never heard of this before. It's so devastating. Now, I have to ask you this, and it sounds like really gross, but I know the black ink tattoos possibly are associated with this uveitis and on any part of your body, but is there something called eyeball tattooing? Am I getting this right, Dr. Levison?
So there is eyeball tattooing. This is different than the tattoos that we were talking about previously, but patients, some people do opt to get tattoos of the white part of the eye called the sclera. Unfortunately, this is not a procedure that is studied in the world of ophthalmology or in medicine, and unfortunately can have very, very severe consequences to injecting dye, because unfortunately sometimes it goes where it's not meant to go, and patients have lost their eyes before due to eyeball tattooing.
Well, you know, it seems to me like a no-brainer.
I wouldn't recommend it.
No, I can't even
I wouldn't
comprehend. It's horrible. But you would actually see a pattern on the eyeball, theoretically.
Yeah, on the white part of, on the white part of the eye.
Oh my gosh. So if you have a black ink tattoo anywhere, hopefully not on your eyeball for heaven's sake, what should people look out for, Dr. Levison?
So in this condition, what people get is sort of an elevation. They can get nodules, so just bumps on the tattoo, or actually the entire tattoo can become raised.
Wow, okay. And treating, is there any treatment for this uveitis?
Yeah, so initially patients are either, if it's a mild case, get topical eye drop steroids. Sometimes they need systemic steroids. And then ultimately in chronic cases, patients go on to medications called immunosuppression, where it can control the inflammation but doesn't have the long-term side effects of steroids.
Wow, well, I'm glad to hear that there are some treatments, but I think perhaps the best thing is just avoidance altogether of black ink tattoos, or heaven forbid, eyeball tattoos. But fascinating information. Thank you so much.
Thank you so much for having me.
Dr. Ashleigh Levison from Retinal Consultants of Arizona. Great information. Good heavens. Think twice about that black ink tattoo or eyeball tattoo.